Hello, my name is Toyin Oladimeji. I'm a DNP Psych Mental Health Nurse Practitioner student at Brahman University, and this is my Nursing 645 evaluation summary of my clinical experience. This is unbelievable. My clinical experience has finally come to an end. It has been a wonderful experience so far. These past 4 months have been very tedious. I do not know how I've been able to do it. I have to rearrange my schedule to allow me to go to my clinical site 4 days a week. I put in 10 hours each day. I have done this so that I can finish on time, and to God be the glory. This is it. Today is the last day of my clinical rotation. I have no time to waste because I still need to focus on my clinical scholarly project. That means it's not over until it's finally over. My clinical experiences took place at Dogon Behavioral Medical Group and Dogon Psychiatry Services here in Riverside, California, in the Inland Empire area of Southern California. This facility is an outpatient clinic providing outpatient mental health and psychotherapy services to patients across the lifespan. I've seen patients here as young as 6 years old and as old as 88 years old. The clinic is centrally located in Riverside County in the Inland Empire area and serves patients with Inland Empire Health Plan, IHP, medical or Medicare, private insurances like Blue Cross Blue Shield, Aetna, Cigna, and the patients have come from different parts of the Inland Empire area, as far as Palm Springs and Apple Valley. They drive very far, but they still love the clinic. They come. We have one psychiatrist who is the medical director of the facility, and 3 psych mental health nurse practitioners. We also have 4 clinical therapists. On daily basis at the clinic, we see between 100 to 110 patients for both medication management, and we see 30 to 40 patients for psychotherapy sessions. During my interaction with some of the patients who drive here from places like Palm Springs and Apple Valley, these areas are approximately 1 to 2 hours drive to the clinic. I've asked them why they drive so far to come for treatment. I was told by many of them that they just like the individualized care provided at the clinic. The providers are warm. They understand their needs. They are very knowledgeable and consistent with their care provision. It makes them comfortable. They don't mind the drive, they have told me. My preceptors at the clinic are Dr. Samuel Day, who is a wonderful person. John Adeniyi is a psych mental health nurse practitioner and also has the background in family nurse practitioner. He's very wonderful and terrific. They are very knowledgeable, selfless, and very dynamic, ready to give back. When I arrived at the clinic, I was very nervous. I had fear of unknown. I did not know what was coming my way. But they both allayed my fears. They accepted me as a novice and impacted in me adequate knowledge that will last me a lifetime. This is very emotional for me. I've really enjoyed every single day I've spent at the Dogon Mental Health Services. The therapist that I've spent the most time with is Dr. Clark, who is very witty, dynamic, and smart. She has shown me how to conduct different psychotherapeutic modalities, especially cognitive behavioral therapy, CBT, and mindfulness. I sat with her for 30 hours and I really enjoyed a lot from observing how she performs at psychotherapy sessions. She has been at the clinic for a few years. She was actually a student, so she trained at the clinic. And she told me that she enjoys what she's doing. And you can see, you can tell from how she interacts with the patient. They come every 2 weeks and they are very appreciative and receptive. They recover better from depression and bipolar disorder with combination of medication and psychotherapy, as evidenced by their PHQ-9 documentation. Description of the best and the worst. The experience I've gained at the clinic has surpassed my expectations. My expectations were far less. I've been able to discover that the patients at the clinic are very committed to their treatment and recovery and stabilization. I've been working in a psychiatric emergency room with a different type of clients or patients. They are mostly indigents and have issues with medication compliance, either due to poor judgment and insight or lack of insurance. Whereas at this clinic, the patients are more elite. They understand the needs, the reason why they need to be stable so that they can be good parents, daughter, son, or the need to be stabilized so that they can stay in school or complete their education or even keep their jobs. They show up for their monthly or bi-weekly medication management and or psychotherapy sessions. The monthly treatment team meeting is an event that we all look forward to at the clinic. We just had one yesterday. This is not a redundant environment. There's opportunity to learn and grow. The providers are also very open about sharing their experiences. And this is the worst. The only worst thing I have seen so far is that some of them feel that it's too much for them to come to their monthly medication management. I'm talking about the patients. And they skip appointments. Sometimes they can even stop taking their medications because they feel they are stable enough to stay off of them. Just yesterday, we had a patient who said, I've been halving my Lexapro, cut it into half because I'm no longer depressed. I went back to work and I no longer need my medication. She took matters into her own hand and just titrating herself off of the medication slowly because they are elite, they know what they want. Anyways, moving on to response to readiness. With what I've learned and gained from this clinical experience, I'm ready to be a psychiatric nurse practitioner. Seeing the patients when they come in depressed, anxious, or psychotic and monitoring their progress, watching them recover gradually is not just encouraging but rewarding. Sometimes I tell my preceptors that this makes us feel good. It makes us feel that we are doing something right and the patients appreciate us too for taking care of them and putting them on the right medications combination to stabilize their mood. I was not allowed to see patients alone for both medication management and psychotherapy sessions due to liability and insurance company issues. They have to document the provider right, and they don't want students to see the patient, otherwise they will not get reimbursement. However, I've been working with patients with mental illness for over 2 decades. I work in both inpatient and outpatient clinics. I've run mobile crises. I do psych evaluation and mental health assessment on a daily basis in the psychiatric emergency room where I'm currently working. I'm confident that when I start working on my own, I will not have any problem seeing patients by myself. I have confidence in the knowledge I've gained. I can prescribe medications, and my preceptors sometimes ask me for my opinion. They want to know if a patient show up, what will you prescribe for them when they are depressed or when they are feeling anxious, what medication combination, and my opinion has really mattered to them. They have not taken my opinion for granted due to my immense knowledge in medication management and psychiatric treatment. Discussion of personal change. Personally, my perception has really changed. I know about billing aspect of care. My preceptor really opened up to me about how much they are reimbursed by the insurance companies per patient, and also for the psychotherapy sessions. I now have understanding of billing and coding systems. Also, I was able to learn from some medications need to be pre-authorized by the insurance companies before they can be prescribed. Otherwise, the pharmacy will not dispense. And subsequently, the patient will not be able to take the medication as prescribed. In short, the insurance companies are in control of the whole healthcare system in the United States. Overall evaluation of clinical experience. I feel ready. My predecessors say they've done a fantastic job. I feel confident to see my patients alone. While in training, I was given various assignments which I completed in a timely manner, such as looking up different medications that we prescribe at the clinic and their side effects. Assignments, also I was given assignments on borderline personality disorders, bipolar disorders, and various other ones, like the criteria needed to be able to diagnose a patient with major depressive disorder, attention deficit hyperactivity disorder, panic disorder, and so on and so forth. I've developed more insight. I know now to evaluate the patient's knowledge and needs, and to see what medication they will be consistent in taking. Consistency is the key. Consistency is the key. I seek their opinion before prescribing their medications and educate them after prescribing it about the side effect. They need to report to the emergency room. I give them emergency precautions to make sure if they have any problem before their next appointment, they don't need to wait. They can go to the urgent care emergency room for treatment. The collaborative approach is really good and will ultimately encourage them to be consistent with their medication, with their prescribed medications. It fosters patients' empowerment and makes them feel that they are in an essential part of their own treatment plan. In conclusion, I've gained tremendous knowledge and I've enjoyed every moment that I've spent at Dogon Behavioral Medical Group and Dogon Psychiatric Services. The good news is that I've been offered a job at the clinic. They are so impressed with the outcome, with my attitude and the interaction with the patients and their family. They are just waiting for me to graduate from Brahman and come back to the clinic to work. They see me as a valuable asset and a wonderful intellectual addition to their establishment. This has made me very proud. They are looking forward to my coming back. They told me to hurry up, take my exams, and get all my paperwork in place so that I can come back. Since the patients already know me, they want me to join the clinic and work with their organization. I'm really grateful to you, Dr. Williamides, for all your support. And I'm really, really appreciative because you are a very knowledgeable person and you are a mother, you are a wonderful guidance, and I really, really appreciate everything, your leadership and all your promptness. Thank you very much. I'm looking forward to seeing you very soon. You are a wonderful person and God bless you.